Delightful to be here. I'm one of the co-chairs, of course, of this steering committee on health and climate change, along with Professor Fran Baum from Adelaide and Professor Tony Capon from the Monash Sustainable Development Institute at Monash University. I'm joining you today from Wangal country, very, very wet Wangal country at the moment. I think the acknowledgement of country is particularly important today because, as you'll soon hear, an important part of this statement emphasises the need to respect Indigenous knowledge practices, particularly about sustainability and environmental connectivity when dealing with climate change. But more about that later. I will also draw your attention, I do hope my slides are working, and the principle of one should never trust anyone over 60 with a Zoom presentation. But anyhow, I hope that's working. I would like to draw everyone's attention to the fact that this is World Health Day, and the WHO has declared that it is about our planet, our health, that is planetary health, if you like. Indeed, the WHO has just last year, as we were finalising our statement, pointed out that the greatest health challenge, health threat to humans now is climate change, not in the future, but now. Let me just say a few general words about the statement. First of all, I'd like to say it's been a very long time in the making. We began as a committee to gather evidence for the statement early in 2020. Now, as all of you will know, another event supervened, which led to many of us dedicating the last couple of years to other issues, to dealing with the pandemic. But we have managed to get back on track because, as we know, as is clear in our statement, the challenge of climate change is probably even greater than that of this pandemic and future pandemics to public health globally. So since we finalised the statement late last year, I've already mentioned the WHO declaring that climate change is the greatest threat to human health we face now. I also draw your attention to the IPCC report recently, earlier this year and just in the last few days, which actually details many health impacts of climate change. Now, today, I don't want to dwell on the report. I hope by now you've all received a link to the statement, and that you've had a chance to read it, or will soon have a chance to read and reflect on it, and to circulate it widely. That would be good. So I won't go into any detail at this point, really. But I will draw your attention to a few special features of the statement. The first is that the statement is evidence-based. It's scientifically robust. It derived from extensive discussion in 4 expert roundtables or workshops. All the experts nationally, were brought into this to help contribute to the Academy's statement. And I would very much like to thank all those participants for their assistance in putting together the statement. The second point I'd like to draw your attention to is that it's very much focused on the Australian specificities. What will the impacts be on Australia and the Australian people and the people of the region as well? Quite often when we talk about climate change, it all seems too abstract and global, but we wanted to make it real on the ground in Australia as well. A third point is that we emphasise both the need for action based on the evidence we already have and the need for further research to inform future decision making. And in this way, it's very similar to the response to tobacco control and the dangers of smoking, where it was clear that that was already a threat, a hazard, but more research still needed to be done. And that's certainly the case. And it's a very similar issue, only scaled up enormously and therefore far more of a challenge. The fourth point I'd like to make is that unlike most other statements of this sort, we've emphasised Indigenous knowledge practices, Indigenous ways of knowing and doing. And we'll talk more about that a bit later as well. That it's very important, if difficult, to try to articulate between Indigenous understandings of sustainability and living in a delicately balanced environment with conventional science and medicine. That's another task for further research, no doubt. Now, yes, I won't go into any detail. As I say, it's all there in your in the statement, which you have access to now. So I won't go over that now. And we'll leave it at that. But before we go on to talk with the distinguished panel, which I'm sure you're all waiting for, let me thank my co-chairs and all the members of the Climate Change and Health Steering Committee who've done such a tremendous job over the last 2 years, despite all the necessary distractions of the pandemic and so on, and other health problems. So I'd like to thank all of those members of the committee. I'd also like to again thank the participants in the round tables and the workshops over the past 2 years too. I want to thank Professor Sheffer as the president of the Academy and the council of the Academy, who so strongly supported this initiative. And above all, I want to thank the Academy Secretariat, which is without them, this would never have happened. So thanks to Catherine Lucken and Kath Latham and Larnica Malvaganam and Margaret De Silva and many others, I'm sure. So let me now move on to very quickly introducing our panel and starting the discussion. Of course, this is a panel that really needs no introduction. Indeed, if you need an introduction, well, you shouldn't, because anyhow, let me just say very quickly that for those of you who don't know, Peter Doherty, of course, won a Nobel Prize in 1996, I think, shared with his colleague Rolf Zinkernagel for their discoveries about T-cell mediated immunity. And Professor Doherty has become, in recent years, a proponent for action on climate change, and he expertly draws on the links between science, climate change, and health policy. Professor Fiona Stanley, the patron of the Telethon Kids Institute in Western Australia, was Australian of the Year in 2003. And as an epidemiologist, Professor Stanley tackles a number of wicked problems, such as climate change. And she's been sounding the alarm on climate-related issues for, especially those related to children, for many years now. And thirdly, Ian Anderson, who's currently the Deputy Vice-Chancellor at the Australian National University. Now, Professor Anderson has spent his career working in Indigenous health and education. He was Deputy Secretary of the Deputy Secretary for Indigenous Affairs in the Department of Prime Minister and Cabinet from around 2017 until 21 or 20, before heading off to the ANU. Recently, Professor Anderson has been highlighting the vast opportunities for Aboriginal and Torres Strait Islander leadership in moving towards net zero and better health outcomes for all Australians. So to start the conversation, I thought, now I think I've stopped sharing. To start the conversation, I thought I would ask everyone really just at this point, just when they first became aware that climate change was such a serious health issue, how it happened and how it changed the direction, in a sense, of their career. So shall we start with Fiona Stanley, please?
Thanks very much. I'd just like to acknowledge that I'm on Wajaki Noongar Budja and pay my respect, of course, to all of those with the best knowledge in our place to handle how you manage the planet. I go right back to Paul Ehrlich and Rachel Carson, actually. Huge influence on what I thought about planetary health and looking after the planet, not just specifically climate change, but then very much affected by Barry Jones and Al Gore, 1980s, who were onto it pretty quickly. And the other two people that absolutely have to be mentioned as great influences on me are Bill McKibben, who runs 350.org, which we've worked on here in Australia. But the person who should be our champion and who we should dedicate this presentation to is Tony McMichael. And he wrote wonderful books, not just on climate change and effects on health, but the whole ecosystem, the whole anthropomorphic ecosystem. And it's very interesting that there's been no NHMRC funding for climate change projects since Tony died in 2014. And I think that's, I think, Peter, you and I actually wrote a paper on that for one of the Nature articles to point out just what a serious lack of funding that was. Does it reflect a lack of interest from health and medical researchers in this big topic? So how could one not be interested in this? As you say, I'm particularly worried about child health and child wellbeing because they are going to be the most vulnerable. They're going to be exposed to it for the longest. And Tony and I actually Tony McMichael and I wrote a paper about that some years ago now, about why children are particularly vulnerable, immune systems not developed, more likely to get things like respiratory diseases, and of course, increasing proportions of our young people who are getting depressed by this whole issue.
Peter, do you want to? Yes, thank you, Fiona. Thank you. Peter, do you want to add to that?
Specifically with respect to climate change, I first became aware of it in 1997. Seriously aware of it, the year after the Nobel Prize. Under the rules back then, I was made Australian of the Year while I was still living in the United States. Of course, that's all changed. It's a different mechanism. But we came back to Australia, I think, about 4 times that year and spoke in all the capital cities in big groups in city halls and so forth. And I was getting questions on climate change because when you win a Nobel Prize and you become an authority on everything, and totally fatuous, of course. And often this was the first time a number of people had really been in the same room as a serious scientist. It was a different area of communication. And so So I started to think about it a lot, and I wrote about it a bit in 2005, and then eventually started to focus more and more on the parallels between how we deal with information and responses in the medical sciences and in the climate science area. Wrote a book about it called The Knowledge Wars in 2015. So I've been involving myself in this area for quite a long time. It's complex, it's difficult, it's a difficult political sell, as we all know, but God, it's massively important, and we have to work out better how we communicate and act in this area.
Yes, thank you, Peter. Now, Ian, do you want to come in here and have we?
Yeah. Okay. Thank you.
Yeah.
And very, very pleased to be talking at this, what I think is a very important occasion there. If I can just speak to why this is an issue for Indigenous Australians, not just in Australia, but globally. The first thing is that Indigenous peoples are globally amongst the most marginalised people across the globe. They are often living in environments that are marginal in terms of climate change. So the far north, for example, arid lands in Australia, these are the sorts of environments that are most deeply impacted in terms of what's happening. And they are the sorts of ecological environments socially which are likely to have profound social and economic consequences for Indigenous peoples. The second reason is that Indigenous peoples actually have traditional knowledges that are really key to seeing a way forward on this important issue, both here in Australia and globally. In Australia, there is a very long tradition of ecological practices around management of ecologies, fire management techniques that are just so critical today and critical to understanding what are the ways out of this dilemma. So there is I think a very important contribution that Indigenous peoples have intellectually to finding a path out of this difficult and challenging and indeed quite existentially threatening circumstance that we find ourselves in. And I think the third reason that Indigenous peoples here in Australia and globally need to be played into this conversation is that there is actually economic value in some of the strategies that could be put into play, carbon farming, other tropical savanna management, and so on, that actually are so critical to the path forward. So if our approach to climate has really emerged because we globally, people have forgotten those very traditional knowledges that are so important to protecting environments, ecologies and health, then there is a very significant place for Indigenous peoples across the globe in finding a path out, in navigating that path intellectually, and potentially in finding some sort of economic path forward for Indigenous peoples both here in Australia and globally.
Thank you very much. And I should point out to people that because of Ian's crucial participation in the committee that drew up the draft statement, that we were aware that so often Indigenous presence is represented in terms of vulnerability and victimhood even, but we wanted also, and as Ian points out, that is a problem too. They are particularly vulnerable, but at the same time, we wanted to emphasise the need to learn from Indigenous knowledge practices, environmental understandings, and the way they have lived and in rather difficult environments. And there's much to learn from that, there were different sorts of sciences, of course, and to integrate that science with conventional sciences one of the goals we hope that that will be stimulated by the statement. Now, I was interested to know what each of you feels is the most pressing issue or set of issues about climate change and health in the Australian context at the moment and maybe in the near future.
You want me to start again, Warwick? I'm very
Why
happy.
not? Whoever.
Okay.
Yes, that'd be great.
Well,
Thanks, Fiona.
I think that the challenge that we have is that, particularly amongst some politicians and other members of the bureaucracy, there's a very poor understanding of the causal pathways into climate change. I mean, I keep on talking about the extreme capitalism and the overconsumption and the excessive use of fossil fuels and so on. So that either they have a poor understanding of it or they'd want to ignore it. And the political understanding of the causal pathways from climate change into all the health outcomes, I think, has been underutilised by us as a group of advocates, but also getting that knowledge out into the community. We are the only country, I think, in the OECD that does not have a National Centre for Population Health or like a CDC. We have a great capacity in epidemiology and public health. And look at COVID, what it did to show that. Everyone can spell epidemiology and they know what we do. And if we had a National Centre of Population Health, a whole part of that should be about how we adapt, mitigate, get data on, and use the expertise around Australia in relation to climate change and all the other things that our ways of living on this planet are damaging, like environmental degradation, vulnerability of species, agriculture, and so on. And so I think one of the pressing things we need to do as a nation is get a centre for climate change and health, or get a centre for population health and wellbeing, which has a major focus. There's no even centre in the health department in Canberra, which has got the title climate change, or that. And I think that's absolutely what we do. And the last point I want to make is, I think it's sort of best put here, is that in the Intergovernmental Committee on Climate Change and everyone's reports, they talk about a mean rise of 1 to 2 degrees Celsius. Doesn't sound very much, but what you look at when you look at the distribution of temperatures, a 1 to 2 rise in the mean means that at the higher end of the distribution, I did this for Western Australia, the percentage of days over 35 has risen dramatically in the last decade. And that's what's going to affect the health and well-being of our population. At the same time, the distribution at the other end of the numbers at the other end of the distribution are showing a warming of things like the poles and the fact that there are fewer cold days and the warming of the permafrost and all those things. So I wish people would actually put it into a more urgent perspective of distributions rather than just looking at means. Thank you.
Yeah, I think
like a true epidemiologist, Peter, yes.
With respect to the temperature increase, people focus on that as though they're going for a vacation in the tropics. Basically, we're talking about an enormous increase in the energy of Earth systems. And that's what we're seeing with these massive rainfall events, the droughts, the heat waves, and so forth. So it's energy, and that, of course, is more difficult as a concept to get across. The problem with talking about health and climate change is the implications for health of every aspect of climate change are profound. From everything from food security to fresh water security to security re dry land. I mean, you talk about indigenous populations in the far north. A lot of them are living in areas which will easily be overrun by ocean flooding. And so there's a massively diverse thing, and that makes it difficult to take it to the politicians and the public, because it's such a broad spectrum. So we have to focus our message if we can. One of the things that's obvious in say, with human health is building buildings, houses, hospitals that actually protect people and are resilient. The property developers resist it. It's easier for them to build ticky-tacky McMansions that do nothing along these lines. We could make somewhat smaller houses and build them for the same cost. There's all these applications and areas of focus. I think we need to focus very seriously in whatever we take, particularly into the political arena.
Right. Ian, the most pressing problems in health and climate change in the Australian context?
I think there's one problem, is political action.
Mm-hmm.
So I think the intellectual challenge is huge. The political problem is quite small. It is, we are at a moment where industry, business, the academic sector, the Australian population are all aligned. We need to act soon. But there is a simple political, and most governments in Australia are too. Most state governments are pressing forward on climate action. The simple political problem is that at the federal level, there are a group of politicians who are stuck, and they are stuck on trying to protect the energy sector. The energy sector, by the way, is far ahead of our Australian government in thinking through how it adapts to the new global economy. But there are a bunch of politicians, a small group of politicians, who are out there thinking that problem is their political problem, and that problem is going to stand in the way of them getting re-elected in regional Australia. That is as simple as the political problem is. It is not complicated. We tend to, and that is the trajectory. So I think that we must press forward on finding technology solutions. We must press forward on understanding the impacts on health from an epidemiological perspective. We must press forward in helping those colleagues of ours in business, in industry, in the academic sector, in government to make change. But the actual political problem in Australia is quite simple. It's a small group of politicians who think that protecting coal, protecting our mining industry is in the broader interest. And I think that even in those industry sectors, they are moving past.
Yes, yes. I mean, related to that issue, that problem, I mean, what do you think the role of the Australian health and medical research sector is in combating the effects of climate change, the health effects of climate change? What do you think?
So I think that, as I said, the intellectual challenge is large, and the intellectual challenge is about mapping out the impact, but it's also about us working with building those alliances with the change makers, with the political class, with industry, and actually developing those alliances to progress change despite that small group of politicians in the federal parliament who are still resisting.
Fiona.
I mean, yeah. Well, I honestly think this is a call to arms. I honestly think the medical profession, and particularly the paediatricians, have been very quiet on many issues that are important for the health and well-being of our kids and our young people. And this is the biggest one. We have huge power. We have huge power. People listen to us, doctors and health researchers. Look at the COVID example. I was hoping that it would spill over into the science of climate change. So we do know, I totally agree with Ian, that we need to move and create great collaborations so that we can have that sort of credibility. But that credibility can work really for us, but we've just got to use it. We've got to be out there writing the articles. Look at The Guardian, apparently I'm on the front page today. But, you know, we've got to be out there doing that and use that credibility. Always stick within the data, never be exposed to sort of making outrageous statements. But, you know, we need to push for abandoning fossil fuels. That's absolutely crucial to the health of the people and the planet and the reef and so on. But another nice thing that we can do as doctors and researchers is that if you want to be personally healthy, you know, eat less meat, ride your bike to work, walk, use public transport, you reduce air pollution. That's good for us. It's good for our health, but it's good for the planet. And I think the marvellous Dr. Nicholas Watson, I can't remember his name, NHS doctor, who wrote an article in the Lancet about this. It's true. I mean, so we can sell that as individual doctors, but really enforce it by saying, hey, it's good for the planet as well, if you do these things. Buy electric cars or walk to work, etc. But let's be advocates. Let's use our power.
Now, Peter, what do you feel about that? You're on mute, Peter. You're on mute.
Hit the space bar. Yeah, sure. Yeah, I think each and every one of us can advocate, particularly within our specific area of expertise. And we've reacted to substantially a respiratory virus in a big way, but then all those other respiratory problems that are associated with burning fossil fuels and so forth are also something. I mean, basically, it's not the energy generation sector that is the problem, it's the energy extraction sector. And the problem with the energy extraction sector is it's not a sophisticated sector. In fact, it's very unsophisticated. And even if you replaced a lot of the present players, you'll have other players coming in below them, the Clive Palmers and their like. And so that's the real difficulty. And it's this constant jobs thing. So we have to find solutions that are broadly based and retraining and having long-term strategies. But we have a government that has no policies. So you need policy. I mean, that's what governments are for. Policy.
Now we're focused really on the need for action, on the need to recognise, in a sense, a duty of care for the planet, really. But let's, before we finish, just think too about medical research itself, given the nature of the academy. And are there particular challenges for Australian medical research that come out of the climate crisis?
Well, I made the point that, in fact, NHMRC hadn't funded until recently any projects because they didn't have Tony McMichael as a CI. And that's an indictment on us as a group of researchers. I think we do need to get the kind of research that's going to put evidence into action, that's going to put really good research out there to prove the extent of climate change, which is happening now, on the health and well-being of our populations, and to publish those data regularly. This is why if we had a centre, a National Centre for Population Health and Wellbeing, we'd be putting those data, every flooding, every fire, every heat wave, the aspects of why kids are feeling depressed, get those data out. And I think we also do a whole lot of meta-analyses on other countries and what they're doing to adapt and mitigate. You know, are we just going to tell old people to go into shopping malls so they can manage to get away from the heat? And what about the building? We need to collaborate with all the other scientists, the social scientists, the climate scientists, the people who are interested in buildings, who are planning cities, green space and so on. That's the kind of research that gets translated into action quickly. And it needs to be quick. We need to actually galvanise health and medical research attitude to actually saying these are what we need to work on now. And boy, did you respond to the COVID pandemic with fantastic research and got vaccines and so on. Well, come on, this is as big a problem. This is more of a problem. And there's even evidence, I think, and I don't know if Peter would support me, that in fact, the way we are living on the planet now is likely to cause more pandemics. So I'm not saying that climate change is a direct cause of pandemics, but there are lots of links from the way that we are degrading the environment, which means we have more contact with bats and all those sorts of things. I don't know if that's true, but it's another way we need to look at that research and say, come on, this is really important.
Now, unfortunately, we have to be quick as well. I've only got a couple of minutes, but do Ian and Peter want to add to that eloquent commentary on the research challenges of the climate crisis? Peter, you're muted again.
It was eloquent. I don't think I can add anything. Thanks, Warwick.
Right, okay. No, I thought it was wonderfully eloquent. And Peter, if you unmute, were you speaking before? Yeah.
Yeah. I think all people are focusing on now is getting back to business as usual. We've done a lot of great things that are going to help, like working from a distance and not commuting in to centres every day. That could help. I mean, the other thing, but all we got to do is get back on planes and fly around the planet. The reason we're going to have more pandemics is because people who live in places where viruses cross over are getting on planes and flying around the pandemics. That's very clear. It's very clear from the coronavirus experience. We had 2 in the human population before 2000. We've got 5 new ones since the year 2000. So basically, we've got to look at all our practices. What could we do that would actually engage people and really make them focus on the climate change issue? A national competition maybe for how do we build cheap, affordable, fire-resistant housing for people who are burnt out? Yeah. How do we get people off floodplains? I mean, that'd be a good start.
Yes. Look, now, we could continue at least for another hour. I'd love to do that, actually, but unfortunately, we are scheduled to end in a minute or two. So I'd have to stop the conversation then. We had hoped to have some questions from the audience, but unfortunately, we have no time for that, given the eloquence of the panelists, which is a good thing. But I just wanted to, before I hand over to Ingrid, say that I had a look at the climate policies and the health policies of the Labor Party, the Liberal Party, and the Greens, and none of them addresses the issue of the health effects of climate change. The WHO says this is the greatest challenge to human health, and none of our major parties has addressed that in their health policies.
Actually, Warwick, the Doctors for the Environment are going to have a series of meetings around the country with all of the candidates to ask them just this question.
That's a very good start, and I hope too that the Academy's statement on health and climate change will help to reset that political debate in the ways that you've all described. I think that's great. So thank you so much for a brilliant discussion, really illuminating. I'll hand over now to Ingrid Scheffer.
Thanks, Warwick. And yes, my thanks to the panel. That was so inspiring. I'd like to commend the Academy's statement to you about climate change and how it is the greatest challenge facing human health today. It's essential that our Academy tackle this critical topic, and our statement I see is really the beginning of the Academy's journey on this topic and to frame the way forward. Health should be a crucial consideration in all climate policy, and equally, climate change should play an important role in all health policy. I want to reassure you that the Academy is going to continue its work in this space to achieve the priority actions highlighted in the statement. And then on behalf of the Academy, I'd like to start by thanking the co-chairs of our committee, Professors Warwick Anderson, Tony Capon and Fran Baum, and they've all brought their passion to this incredibly important topic. I'm sure you've enjoyed the opportunity to share thoughts with our panel, who are really Australian leaders in this field, Professors Fiona Stanley, Ian Anderson and Peter Doherty. I'd like to thank you for making the time to join us today, and also the many different contributors to our very interesting roundtables, and I certainly enjoyed being able to attend those. Our project steering committee deserves our thanks, and that's Professors Stephen Duckett, Lee Giles Corty, James McCarthy, Tanya Sorrell, Jane Fisher, Tarun Weramanthri, Associate Professor Coral Gardner, and of course Ian Anderson. And for the Academy Secretariat, I'd like to thank Larnica and Catherine for a fantastic job in bringing this all together. Now, the video of today's session will be on the Academy website, so you can watch that at your leisure. And I'd like to close the launch of our statement today and hope I've brought that our panel has brought some new thinking to your world and how we can take this very important topic further forward. Thank you.